There are a number of First Nations communities who have expressed that they are not ready to receive visitors, and that their paramount focus right now is on protecting their communities, and particularly their elders in their communities. And we are very supportive of that. I'm working closely with the First Nations Health Authority to make sure we have what they need in place, to make sure they have the testing they need. We have we've brought in the ability to have testing in First Nations communities in a rapid way. That's been a focus over the past number of months. We also have an agreement about exchanging information with communities about people who test positive, and we have plans with communities to make sure that if people do test positive, we are able to work together to support them and manage that. So those are all a primary focus of my office, and I do understand that many First Nations communities are not ready to have visitors, and I absolutely support them in those decisions. But it is not just First Nations communities. I've also heard from a number of other communities that feel that they don't have the infrastructure in place to support large numbers of people coming in at this point, and that they have concerns about transmission both in their communities, but also, things like not having the grocery stores. And though much of the supply chain has been worked out, there are some communities who are feeling particularly vulnerable still. In terms of negotiating those things, that is something that is between government and between governments with First Nations governance and the province, and it's not my place to comment on those.
Vaughn, do you have a follow-up?
Yeah, I was just interested again because of the complexity of the province and the fact that, of course, there are tourism-dependent communities that are adjacent to First Nations communities and that overlap. Do you have any sense of, I guess, can this get sorted out, and how do you think it will be sorted out, or do you see a way clear to sort this out?
Yeah, I know there's ongoing tables where those discussions are happening. My office has been involved in some of those, and I know that those discussions are ongoing. So I expect that is the fora where these will be worked out.